Well, good afternoon, everyone, and thank you for joining Caregivers Alberta webinar series. My name is Keith Johnson, and I'll be your host for this session. Today's topic is on your community pharmacist, a partner in caregiving. Before we begin, I'd like to take a brief moment to acknowledge the land on which we live, work, and thrive. Caregivers Alberta acknowledges the traditional and ancestral territories of Treaties 4, 6, 7, 8, and 10, namely the Blackfoot Confederacy, Kainai, Piikani, Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, Tsina, Inuit, and Métis, which includes 6 regions across Alberta and the 8 settlements. We acknowledge as an act of reconciliation the many First Nations, Métis, and Inuit who reside or are visiting these territories, and the many other First Peoples of Canada whose histories, languages, cultures continue to enrich our vibrant community. Caregivers Alberta acknowledges these traditional lands upon which we live, work, and thrive. We recognize that all Albertans are treaty people, and it is our responsibility to pursue a deeper understanding of the meaning of the friendship treaties so we can honor and respect the respective view of Indigenous people and continue to learn our shared histories. We also acknowledge the harms and mistakes of the past and invite all to consider how we can each, in our own way, try to move forward in a spirit of reconciliation, in particular as we strive to offer supports to the many First Nations, Métis, and Inuit caregivers through respectful collaborative efforts. We invite you to take a moment to reflect on the lands you are joining from as well. Before we dive into our topic with our speaker, I'd like to take a few moments to go through a few housekeeping items. First, throughout today's session, you are welcome to submit your questions using the Q&A button at the very bottom of your Zoom screen. You can type your questions. You can type your questions at any time during the presentation. We will address as many as we can during the dedicated Q&A portion at the end of the session. You will also notice that the chat function has been disabled for participants, but don't worry. We will be sharing links, resources, and key information in the chat throughout the webinar. Keep an eye on it for anything you may want to bookmark or download. Additionally, today's webinar is being recorded. A link to the recording will be shared in a follow-up email post-webinar in about 3 to 5 days. As well, you'll be able to find the recording on our Caregivers Alberta YouTube channel. And now to what you've been waiting for, our webinar for today. It is my pleasure to introduce our speaker and our topic. Please welcome Amin Kanji, a pharmacist and healthcare leader with more than 30 years of experience providing exceptional patient care. Amin is passionate about helping people understand and manage their health and takes a personalized approach to supporting patients and improving their overall well-being. He holds a Bachelor of Science in Pharmacy with honors from the University of Alberta, a degree in microbiology from the University of Calgary, and completed his hospital pharmacy residency at Foothills Hospital. He's a certified diabetes educator and holds numerous advanced certificates, including additional prescribing authorization, certified asthma educator, injection and vaccination authorization, travel health certification, and compression stocking fitting. As the owner of 2 medicine shop pharmacies in Calgary, Amin provides a wide range of services, including medication management, home visits, vaccinations, diabetes education, care planning, and health education for seniors and community groups. Please join me in welcoming Amin to the webinar today to present on our topic. Thank you for being here today, and the floor is yours.
Thank you for having me. Yeah, thank you very much. So welcome, everyone. I want to welcome all the caregivers and first of all, just say a huge thank you and a shout out to all the caregivers who spend a lot of time and effort and energy looking after individuals, whether it be family members, whether it be clients that you look after. I know it's a huge, huge responsibility, and the goal of today is to pretty much tell you about the resources that you can access in the community as far as your personal pharmacist or your pharmacist in your community. So thank you, Keith, for that introduction. And I didn't realize how busy the last 30 years have been, but it's certainly been a amazing time for pharmacists in the country. Alberta was the first province that had moved ahead with pharmacist prescribing and additional prescribing authority for pharmacy healthcare professionals. And now you're seeing across the country as we're dealing with a physician shortage, shortage to accessing the healthcare system, whether it be hospitals or family doctors or emergency room visits, nurse practitioners, pharmacists have the ability to do a lot more. Um, I was lucky enough to even serve on the college. I served on the Canadian Pharmacists Association, served with the Pharmacists Association of Alberta, and we've been advocating for pharmacists to have access to be able to do a lot more things, in the community for their patients as well as in the hospital setting. So definitely part of the healthcare team and definitely play a pivotal role in managing medication management as well as error prevention and just helping with things like minor ailments in the community. So what I'm going to do today is I'm going to, if we can go to the slide, the second slide here about the pharmacy scope of practice. Um, the next slide. So as you see, when you look at across the country, Alberta is all in the blue, which means that we can do a lot of things in this province. If I were to show you this slide a few years ago, Alberta was still in the blue. All the other provinces had a lot of red X's. So we still have a lot of work to do in other provinces, but I'm glad to see that we're moving in the right direction. So I'm going to focus today primarily on what Alberta pharmacists can do. And when you look at this slide, even though I know it's a very busy slide, but we can prescribe independently, we can prescribe in a collaborative manner. We're able to prescribe for minor ailments, and I'll explain a little bit more about that. We're able to, help patients with smoking cessation, tobacco cessation. We can prescribe in emergency cases. For example, if you're on a medication and it's something that we're not able to prescribe, but yet, there is no access to a healthcare professional, we're able to prescribe that in emergency situations. Therapeutic substitution, which means that if a drug is not available, we're able to change the medication to something that is available or something that is a little bit more cost effective as well. Changing formulations to make sure that clients and patients can actually take the medication safely. If it's something that's available in a tablet and yet there's a liquid form, we're able to make that change quite easily. It may seem quite simple, but in the past we were not allowed to make those simple changes. So now we have the ability to do a lot of that. Ability to inject medications, so things like antipsychotics, vaccines, flu shots, COVID vaccines, influenza vaccines. We're able to order and interpret lab tests as well. So again, if we're trying to monitor your blood sugar or your lipid levels, we're able to send you for blood work and then assess changes in medication. So if we can go to the next slide, please. So as you see, Alberta sort of stands out. The number of services that we can provide as pharmacists in Alberta far outweighs the other provinces. Manitoba right now is sort of ranks last in Canada with a number of services it's able to provide, and I think Alberta is being seen as one of the leaders and always compared when governments are looking at how to improve access for residents to healthcare. We've had the luck of having this in place. But obviously, it also comes with a little bit of scrutiny. We have to make sure that we're proving our value and our worth. We're making sure that, we're able to, compare studies with other provinces to see how much money we're able to save by preventing patients from going into emerge or, sitting in a doctor's office and not getting treatment and then, getting admitted to the hospital. So there's a lot of cost savings that come with the additional prescribing authority, and the ability to practice the profession to the fullest, which, in the long term, hopefully helps to save money for Albertans and also for the healthcare system. If we go to the next slide, please. So what does my practice look like? And again, I can speak for myself, but this is something that I think most community pharmacies now provide to their patients. So we can prescribe independently for a condition. So for example, if you have things like asthma, or if you're suffering from hypertension, if you're suffering from eczema, or let's say, for example, cold sores. We're able to make those simple assessments and then prescribe the appropriate medication based on the medications you're on, making sure that we check for interactions, making sure we check it's the appropriate therapy for you, making sure that it's the right drug for the right patient at the right dose with the right outcome. Okay, so it's important that those factors are taken into consideration. We're also able to prescribe collaboratively with other healthcare professionals. So again, a dentist who comes to us and says, I don't know what to prescribe for my patient. He's having a lot of dental pain. He has allergies to aspirin. What else can I give my patient? So again, collaboratively being able to work with other healthcare professionals to be able to prescribe. That is expanding quite a bit as other healthcare professionals are now seeking pharmacists for support. For example, naturopathic physicians cannot prescribe, physiotherapists cannot prescribe, um, and OT cannot prescribe. But in some cases where a physiotherapist feels like a patient would benefit from perhaps an anti-inflammatory cream, we can work with them to make sure that we're able to prescribe for their patient. Prescribing for minor ailments, as I talked about, cold sores, urinary tract infections, eczema, dermatological issues, allergies. So there's a lot of things that we can prescribe for, as long as it's within our scope of practice. Prescribing in an emergency, again, so if someone has no access to a healthcare professional, if they're on a medication for ADHD, for example, we're able to prescribe in an emergency situation, but only for a short-term basis until the patient is seen by their family physician or their specialist. We talked about smoking cessation. So again, prescribing medications that are prescription medications for smoking cessation. As we know, smoking has a lot of risk factors associated with it. And so by helping patients to stop smoking, and again, monitoring their health, we're able to hopefully minimize their risk with other health issues. I talked a little bit about therapeutic substitutions. Sometimes there's drug shortages that happen across the country where a certain drug is not available for whatever reason. And so again, without causing harm to the patient, we're able to make those changes to those medications as long as there is a therapeutic class of medications that is available that will hopefully have the same impact or same outcome. We're able to prescribe in that situation as well. Changing formulations, as I talked about, so those who can't swallow, children who can't swallow medication, we're able to make it into a compounded version so that the patient is able to take the medication. Renewing prescriptions for continuity of care. So, for example, you don't have a doctor's appointment for another week or 2 weeks. We're not going to leave you without medication. We will make sure that we give you enough medication, not only to take you to your doctor's appointment, but maybe even further, so that you can continue to take the medication and get the expected benefit from the medication. Things like blood pressure medications, cholesterol medications, heartburn medications. We prescribe for all of those conditions that patients have. So that is really important because we want to make sure that you don't end up in emergency. You don't have to go to a walk-in clinic. If you have a pharmacist that you have a good relationship with, and they have your information on hand, you can certainly access that information from them. But any pharmacist right now in Alberta can pull up information on Netcare, so they can see what medication you're on. Let's say, for example, you're traveling or you happen to be in a different town where you're away from your local pharmacy. If you walk into a pharmacy, you have your Alberta healthcare card, they can access your information, they can see what medication you're on, and if you're without medication, they can certainly prescribe that medication for you in order to make sure that you are compliant with taking your medication, so that you're not missing your medication and therefore leading to unforeseen circumstances with your health. Next slide, please. So when we talk about minor ailments, what does minor ailments mean? So these are all the conditions that we can prescribe for. As I mentioned, skin conditions, dermatological conditions, which include things like hemorrhoids, cold sores, oral ulcers, shingles, fungal infections, skin rashes. Um, if there's a point where, we feel uncomfortable, or perhaps, you've tried several remedies and it doesn't work, then obviously referral is the next step, referring to a specialist or your family physician. Infections, you're caught on with a UTI on a weekend where you can't get into your family doctor, or an eye infection like pink eye, um, toenail infections, yeast infections, jock itch, those are very, very simple conditions that can be treated with prescription medications, which resolve in within, a few days. Threadworms, pinworms, especially for children who go to daycare. That's really important so that parents can actually continue to, have treatment and their children can be treated quite effectively. Allergies, allergic rhinitis, skin rashes, hives, anything like, coming in contact with grass or pollen or cat hair, dog hair, headaches, muscle pain, painful periods, stomach issues like dyspepsia or GERD. If you've tried Tums and it's not working, or you've tried Gaviscon and it doesn't seem to work, then we can try different medications to help manage your symptoms as well. Any eye issues, infections, allergies, and again, smoking cessation, we can initiate things like patches. And if patches don't work, then we move to oral medications, which are available to help you stop smoking. And again, we monitor you throughout your treatment. We make sure that, the treatment is effective, that there's no interactions with your medications, and that, the symptoms do resolve. So staying in touch, keeping in touch, making a phone call once we prescribe, that is part of our responsibility. We always make sure that we want to stay in touch with you to make sure that your condition has resolved. And if it doesn't resolve, then we try a different medication or try a different strategy to see if we can help support you in that way. Can we go to the next slide? So therapeutic substitutions, again, sometimes it may come down to cost. The doctor may not know that the newest medication that they've prescribed for you is, really expensive and it's not covered. And so typically the newest is not necessarily the best medication. It's just, it's something that is top of mind for the physician because that's the brand new medication on the market. But there's other medications which are more cost effective and which we would be covered by your drug plan insurance. So we try and manage that for you as well to make sure that, if you have an allergy to certain medication or something is not covered, then we can look at other options to make sure that it is cost effective for you and your clients. Changing dosage, sometimes, we get prescriptions where, the dose doesn't exist, or there is no pediatric version, or there is no geriatric version. So we're able to change the dose based on the weight of the formulation. And then again, renew medications to allow clients to continue with therapy as well is important. So can we go to the next slide? Administering medications by injection. So again, this is something that, Alberta pharmacists were able to do. Um, when we were in school, we were never taught how to inject. It was not something within our scope or practice. And a few years after I graduated, all of a sudden, the college decided that with the support from the College of Physicians and Surgeons, that pharmacists would now take some of the load off, physicians and walk-in clinics and take on the role of, medication management. So things like vitamin B12 injections. We have a lot of clients who need antipsychotic medications, which needs to be injected, in the gluteal area or, intramuscularly. And perhaps these clients or family members or patients can't make it to the doctor's office on a weekly basis or on a monthly basis because it's impossible for them to get out. So I do provide, home services, which is sort of the old-fashioned way of where, once upon a time, physicians used to make house calls. So every Tuesday is the day when I visit patients in their homes and I provide them with, injections, whether it be a flu shot, whether it be their vitamin B12 injections, whether it be their COVID vaccines, the pneumonia vaccine. For those that are homebound and can't make it out to either a pharmacy or a doctor's office or a nurse practitioner's office, that's a service I provide through my pharmacy. Now, again, that may not be consistent across the board, but I specifically provide that service because I think that's an important service to provide. And I also extend that to employees who work in the corporate office. For example, we know that if you bring the vaccines to a certain group of people, they're more likely to be vaccinated. So things like flu shot clinics, doing flu shot clinics at the employee's office or taking the flu shots to a recreational center where you have parents and children coming through for sports activities. If they see a flu shot clinic set up, they're more likely to get their vaccination at that time. And we are now able to also inject children from 2 and up. So as long as we've taken a course in how to inject children, some pharmacists are able to now inject children that are over the age of 2. And as we saw during COVID, it was something that pharmacists played a huge role in providing COVID vaccines and keeping people safe, keeping the public safe with all the COVID campaigns. We played a pivotal role in ensuring that, COVID vaccines were provided to as many residents as possible in order to minimize the risk of spread and to keep people healthy, as well as going into long-term care facilities, nursing homes, extended care facilities, assisted living facilities, because the burden on the healthcare system was huge, where, nurses were strapped. There was a lot of healthcare professionals who were sick. And so pharmacists played a huge role in ensuring that, we were able to vaccinate as many people as possible. We continue to do things like travel vaccines. So when you're traveling, I enjoy doing a lot of travel medicine. So when patients are traveling to other countries, we want to make sure that we're providing vaccinations and medications to keep them safe, whether it be things like yellow fever, meningitis, polio vaccine, anything that is prevalent in the country that they're going to. We make sure we do a full comprehensive travel consult and provide them with the vaccinations they need. Pneumonia, flu, COVID, and tetanus are all publicly funded vaccines. So these are vaccines that you don't have to pay for. They're covered by Alberta Health. And so we provide that as well. And to my last point there, providing vaccines in the comfort of your home. So home visitations, where, it's really, really important that just because someone cannot access, the vaccination in the community, they shouldn't be denied to have that vaccine if they, choose to get vaccinated. I'm happy to do a home visit and provide that service in the home where, we can vaccinate them for the flu shot or the COVID vaccine or the pneumonia vaccine. So that's a service that is unique to perhaps not a lot of pharmacists, but that's something that I enjoy doing. And like I said, I reserve one day out of the week to visit my patients that I don't get to see, either because of mobility issues, and I spend time going through their medications, making sure that they understand how to take their medications, looking for drug-related issues, and also providing them their vaccines at the same time as well. If we can go to the next slide. Ordering labs. So why is this important? Sometimes we need to make changes to medication, especially when you're having, side effects or, the medication is not working properly as intended. Things like cholesterol medications. For example, if you're having, cholesterol medication that is not working, your cholesterol levels are not going down, no matter what, we then can order labs to see, okay, what's happening? How can we change therapy? What can we modify? What can we do that's different to make sure that we reduce your risk factor? As we know, if you don't control your lipids, you don't control your sugar levels, you don't control your blood pressure, you're at high risk for strokes and heart disease. Hemoglobin A1C for those that are diabetics. So hemoglobin A1C is a test, a blood test that is done in the lab, which tells you how well your diabetes is managed. If your hemoglobin A1C is not within range, then again, you're at higher risk for, having a stroke or having a cardiovascular event. So we want to make sure that we're monitoring your hemoglobin A1C. We want to make sure that, it is within range. And then if it's not within range, we're able to change the medication that you're on, adjusting your insulin, for example, or adding another medication or increasing your dose. Thyroid testing as well too. Sometimes your thyroid gland doesn't work as effectively. So we're able to send you for blood work for thyroid to make sure that, your thyroid medication is working effectively. Because if your thyroid is not functioning, you feel lethargic, you feel tired, you're losing hair, your skin changes, your appetite goes down. Either you start putting on weight or you're losing weight. So it just depends on what your thyroid is doing. And then titers for hepatitis A and B for travel. It's really important because these are chronic diseases that affect your liver. And if you are prone to getting Hep A or Hep B based on exposure to blood products, exposure to contaminated food, we want to make sure that we're protecting your liver long term, especially because these are diseases that could kill you if you have hepatitis A or B. And then things like electrolytes, your sodium, your potassium, your calcium, magnesium, these can all affect your heart. It can affect your rate of the heart rate. It can give you things like atrial fib or flutter. And we also can do kidney function tests to make sure that your kidney function is within range as well. So again, these are all tests that we can order, and it's a simple form that we give you. You go to the lab, the results come back to us. So whoever's prescribing the test, and we can even copy your family doctor or your specialist to make sure that they get the results. But the onus is upon us. So when, for example, if I see um, something wrong with your hemoglobin A1C or your thyroid, it's my duty to make sure that I follow up with the patient and adjust medication or advise you to maybe see a family doctor if there's something going on there. So these are all things that we're responsible for. Um, and, it's something that you can have access to, for example, if you don't get it from your physician. Now we want to, obviously not order tests for the sake of ordering tests because all these things cost money. But when it's appropriate, and when we don't see a test result being done for a long period of time because either you don't have a family doctor or, the doctor has missed a test or you put on a new medication and, we want to monitor how you're doing on this medication. then it's appropriate to order these labs to make sure that we're following up on your medication to make sure you're getting the most effective use of the medication. Can we go to the next slide? Point of care testing. So these are all tests that we can do in the pharmacy. Unfortunately, these are not covered by healthcare. So, things like strep testing. So, when you have a sore throat and you think you've got strep throat, you can't get into the doctor's office, so you can't get into Emerge. We can test you for that in the pharmacy. And if we get a positive result, we can start you on antibiotics right away. So this is really crucial, especially for children, because as we know, strep can be quite dangerous in children. It's also very dangerous in adults as well if it goes untreated. You can get septic, it goes into your blood system, and then you can get sepsis from that and die. So these are things that are available in the pharmacy where we can give you results within 10 to 15 minutes. Hemoglobin A1C. So if you need to get a hemoglobin A1C right now, if you don't want to go to the lab, we can provide that test for you. But again, it does come at a cost because these tests are not free. They're not subsidized or paid for by Alberta Health Services. So we can do that testing as well too. Lipid panel tests also. We can do blood coagulation test if you're on a blood thinner to make sure that your blood is either not too thin or too thick. TB tests, again, for those that are traveling or coming from another country, and some individuals who go to nursing school, for example, or who are enrolled in certain programs, they require a TB test before they can get admitted into those programs. So we do that as well too. Pregnancy tests. Again, I know now you can buy pregnancy tests and do it fairly easily, but for those that can't do the tests, we will certainly provide the test as well too. And blood pressure. Blood pressure doesn't cost anything, but we certainly are able to monitor your blood pressure for you if you don't have a blood pressure cuff at home, or if yours is not working, we want to make sure that your blood pressure is always kept in check as well to prevent any further disease or stroke or anything like that as well. And I know that some pharmacies also provide the 24-hour blood pressure monitoring device. So you can actually take a machine home, wear it for 24 hours, bring it back, and then the results are interpreted and sent to your family doctor, your specialist as well. So that's a service that is also available from some pharmacies as well. Next slide, please. So I want to spend a little bit of time talking about the care plans. So as we know, care plans are where pharmacists can sit down with the patient or the caregiver and the family and go over all the medications they're on to make sure that, one, that you're on the right medications, that you're not having any interactions, that the medications are working well, and also to make sure that we're able to de-prescribe. For example, you may be on too many medications that perhaps, one is being prescribed by a family doctor, one is being prescribed by a specialist. And sometimes we almost feel like, we think that they're both communicating, but they may not be communicating to each other. And so in those cases, there's a lot of duplication or there's a contraindication. And so we want to make sure that, we're able to sit down with you, go through your medications, make suggestions to changes, and make those changes and communicate those changes to your family physician or your specialist. Medication reconciliation. So, for example, if you or a family member or a client, has a hard time remembering to take their medications, we're able to blister pack them, put them into bubble packs, so that as a caregiver, you're able to administer those medications a lot easier. And so you don't forget to give those medications. And I know in some cases, in order to be living independently in your home, the blister packs is a requirement when it's another allied healthcare professional that's coming to give you your medications. They're not allowed to take the medications out of the vials. It has to be blister pack. So that's a service that we can provide as well too. and it avoids duplications. We pick up on drug interactions, whether it's drug that interacts with your over-the-counter supplements or you're taking some herbal supplements. We can follow up on, how well is the medication working? Is it actually doing what it's supposed to do? Are you having side effects? Maybe the cramps that you're having in your legs is caused by one of the medications you're taking. So maybe we can look for alternative medications, things like side effects, teaching you how to use your device properly. So inhalers, we know that a lot of people use inhalers, but they use it inappropriately. And so if you're not trained on how to use the inhalers, you don't have the proper devices, you're not getting the best use out of the medication. Sometimes it could be a dexterity issue, or you have arthritis and you can't use an inhaler anymore because you can't press down with your thumb. We can change it to a different medication so that you're able to get the most use out of your medication. And this way we can involve caregivers, we can involve family members, and we can involve allied healthcare professionals. So again, medication review is really, really important, at least once a year, to get a comprehensive medication review and a care plan done. This is paid for by Alberta Health Services. It's a service that pharmacists get compensated for. And so, if you haven't had a comprehensive annual care plan done, please ask your healthcare professional, your pharmacist, to make sure that they book an appointment to do an annual care plan, so that, we can catch some of these errors and fix them before, you get admitted to the hospital because you're on the wrong medication or there's some interactions that happen there. So next slide, please. So I'm just going to read this out because it may be small to read, but this was published June 4th. And it's a study that was done on Canadian seniors on multiple prescription medications. So a group of Canadian researchers is recommending that seniors who take several prescription medications undergo an annual review of the drugs they take to avoid the growing problem of overprescribing. They say the recommendation is not just about avoiding medical complications of taking too many drugs, such as increased risk of falls, confusion, and death, but overprescribing can also cost the healthcare system an estimated $1 billion a year. So, it's a huge issue where, there are situations where, we're on so many medications that sometimes, there are combination medications we can put you on, or eliminating one for another may be the right thing to do. So they published a guideline calling healthcare professionals to do annual checkups for seniors age 65 and older who take 5 or more prescription drugs. Okay. And we know that the trend for seniors that take medications is increasing because of chronic conditions. And this is a quote from Dr. Emily McDonald. She said, "Where I work on internal medicine, I sometimes admit patients to the hospital who are taking 15 medications or even 20. So this is something that is a reality. In Canada, nearly 2 in 3 adults aged 65 or older take 5 or more medication, and that complex drugs are rarely studied together and they can interact in unpredictable ways, leading to side effects that can sometimes be mistaken for common signs of aging. So even though we think maybe someone has dementia or loss of memory, that could not be the case. It could be the medications that are maybe causing those symptoms. So again, until the comprehensive review is done, and until, we assess the medications and how they're working together, we just keep adding more medications because we think that our family member or our client has dementia. So we keep adding another medication, not realizing that perhaps the antidepressant medication or the pain medication that they're taking is causing the loss of memory or the signs or symptoms of dementia. Okay. So that's another, huge issue. So the review can be done by a family doctor, a geriatrician, a nurse practitioner, a pharmacist. And they say that 45% of seniors take one or more potentially inappropriate medications. So flagging this, changing it, stopping a medication. This is a bill that was passed in Parliament in 2024. And there are a couple of studies that are published based on this as well too. So this is all, recent information that has been brought to the forefront, where we find that seniors are on multiple medications, and it's not just seniors; it's also people that are less than 65 who are on multiple medications, where sometimes they don't interact, properly together, or they interact with other herbs or over-the-counter medications. And if we don't know what else you're taking, there could be some side effects, or you could be not getting the proper use out of the medication. Next slide, please. So I think that's sort of the end of the presentation, but I wanted to read to you um, just a quote here that came out yesterday, that and a big shout out to all the caregivers who are on the call today. And it says that family caregivers now provide the majority of care in the community and play a significant role across continuing care settings. Caregivers alone contribute to an estimated 647 million hours of unpaid care annually, valued at approximately $12 billion. So, as caregivers, I know that the burden is on you looking after, your client or um, your family member, and it's a huge burden. And navigating the system is getting more and more difficult. It's getting more and more complicated. And so, I really, really, I guess what I'm trying to say is, rely on your family doctor if you have one. Rely on your pharmacist in the community. And if you're not getting that service currently, that's a service that you should be expecting from your pharmacist, because it's something that we can certainly help you navigate the system. In some cases, we are now allowed to even refer you to specialists, depending on the condition that you're suffering from. My area of expertise is diabetes, high blood pressure, geriatric medicine. I do a lot of, hormone replacement therapy as well for clients who are going through menopause or suffering from symptoms of menopause. So again, each one of us has different specialties, but I'm sort of a generalist. I enjoy practicing in all areas. And so, mental health is another area that I also take a big interest in. So again, please reach out. For those of you that live in Calgary and need to access more information, or have questions for me as well. Like I said, I own two medicine shops in Calgary. One is in Killarney, one is in Altadore, which is in the southwest. You can always reach out to me, find me here, have any questions, please don't hesitate to reach out, and I'm more than happy to help. And like I said, if you're not getting the care that you should be expecting from your pharmacist, then it's something that you need to have a conversation with your pharmacist, and perhaps inquire as to some of these services that are available. And home care services, I mean, not a lot of us do that. It is quite time consuming, but I really enjoy doing that. I like being in the patient's home. I can see what medications they're taking. I can see, how they're taking their medications. It gives me a lot of information to make decisions and help them sort of navigate. And again, providing, injections at home in the comfort of your own home. For those that are, have mobility issues, can't get out, or are suffering from, immunocompromised conditions where there is high risk to be out in the public. We can certainly come and I can certainly come and provide you with the vaccines in the comfort of your home. So I will end there, and just want to say again, thank you for the opportunity. I just want to recognize all the caregivers that are on the call today for everything that you do. I know it's a huge task, and it's a huge undertaking, but just I recognize and can't thank you enough for everything that you do for keeping your clients safe, and taking care of them, and but make sure you take care of yourself as well too, because caregiver burden is also a huge issue. And so you need to be looking after yourself so that you can look after others a lot better. So I'll turn it over to you, Keith.
Well, thank you. I mean, that was an excellent presentation. I truly appreciate you taking the time and sharing your expertise and knowledge with us today. We are going to move into the Q&A portion of today's session. As a reminder for everyone in the webinar, the Q&A button is at the bottom of the screen where you can go in and type your question. We do have a few in, so I'm going to go through those and ask those, but please feel free to keep adding questions and we'll try to get to as many as possible today. Um, I'm going to start off with one as I open it up and look at the questions. It's truly amazing, the scope and practice that pharmacists and pharmacies can do now in this province, and the impact it has for caregivers. Especially, I look at it as an opportunity like getting in to see your family doctor. It could be a week, 2 weeks out, depending on the situation, or, going to the emergency, being able to, you know, connect with your pharmacist in the interim for a lot of the pieces you've mentioned can be a significant help for caregivers who are potentially waiting. From your perspective, what impact does that have for caregivers when they're able to access you for some of these pieces now versus going to see their doctor or heading into emergency for some of these pieces?
Yeah, no, I think it's reduced the burden a lot for caregivers. Um, and I think also, for example, when we provide care to the patient and continuity, it's not like we're circumventing the family doctor visit, because at some point, do need to see your family doctor, you do need to be assessed. But it certainly provides, an avenue to have you not go to emergency. For example, if you have a UTI, something as simple as a UTI can cause a lot of confusion, can cause dementia-like symptoms, and if we can treat that in the community setting, it prevents you from going to emergency. Now, if you come in with chest pain and you come in with symptoms that are similar to a heart attack, obviously, we will suggest that you go to emerge, or you go to a family doctor, or you go to a specialist right away. But I think what it does is it allows you, not to go to emerge, and, be treated if it's a simple issue like a UTI. Or, I mean, before, we were able to do a lot of these things. My common answer to most of my patients was, I'm sorry, you got to go back to your family doctor, or you have no refills. I'm sorry, you have to, make an appointment at a walk-in clinic. Or, I'm sorry, you have to go to emerge. So it reduces all that stress from the caregivers and the patients, even knowing that, you run out of your medications before your next appointment because your doctor can't see you for 2 months or 3 months. You don't have to, get in right away. You can take a little bit of time, and get a supply of medication to carry you through. We still have to make sure that you're feeling okay. So if you come in and I need to extend your blood pressure medication, I might just take your blood pressure just to make sure that you're doing okay on it, right? But it does allow us to now provide that comfort that, you know what, I don't have to rush today. Or if someone's not feeling well and you need to cancel your appointment, for that purpose as well, that you don't have to worry, you won't be left out without medication. We will certainly help you and make sure that you continue with your therapy until you are seen by your family doctor. And we always communicate with the doctor to let them know what we're doing so that they're fully in the loop as well. So that's one point that, I think is really important, is closing the loop to make sure that everyone knows what's going on in the system.
That's great. That is great. So one question we do have here is that very first slide you show of the graph of all the provinces. One question here is, why is Alberta pharmacy so far ahead of other provinces?
I think we advocated, so like I said, you know, I was on the board and the College of Pharmacy, and at that time we were starting to talk about pharmacist prescribing, which is something that was unheard of. In some provinces, there's a lot of resistance by other healthcare professionals, for example, physicians who felt uncomfortable. And we dealt with that in Alberta as well too, where, we had the physicians up in arms saying, if a pharmacist prescribes, we don't know what's going on and how are we going to kept in the loop? And I think we've proven that, we've been able to add value and, we're still trying to prove our worth and value. For example, I get involved in a lot of studies right now. So, for example, if a patient comes in and their lipid levels are high, they're at high risk for heart disease. So, we put them into a study where they go through their family physician or they get through the intervention group, which is where I can change their medication. And it's randomly put into two different arms. We always find that, if a pharmacist intervenes and makes those changes, that the patient care and the outcome is a lot better. We're reducing the risk of cardiac disease by 15 to 20%. So the risk of having a heart attack, reduces quite significantly. So, all these studies have proven to not only Alberta Health Services and the College of Physicians that by having healthcare providers and partners in the community can certainly help minimize the risk to Albertans, reduce hospitalizations, reduce cost. And so I think other provinces are now looking at Alberta and adopting the model as we see BC's moving more towards that role. Manitoba is now changing. Ontario is adding more minor ailments now to their list. I think it's a slow approach initially, but then it's getting traction now. But I think Alberta was one of the first provinces that ventured into that. And it wasn't easy for us. I was around the board at that time. We had a lot of resistance. But, I think there also has to be the need to compensate because these services, cannot be incorporated under the current model. So if we're doing all this, there has to be appropriate compensation for that. And Alberta was willing to do that, which was a bold move for the Alberta government to make. But I think what they've been able to see that it has saved money in the long run. And, we've faced shortages in Alberta for family doctors for a long time now. And it's not something that's going to go away. It takes a while to build a pool of family doctors. And, going to a family doctor for a refill on a medication really is a waste of their expertise, their time. They could be doing other things. They could be diagnosing, they could be treating more severe patients, more chronic patients. So I think by giving those services to other healthcare professionals like pharmacists, it's allowing, doctors to have more time with their patients, hopefully. So I think the model has been proven, but one has to set the stage. And I think Alberta was the first one that set the stage because we went and ventured out into that territory where no one else was willing to venture. And now, we're sort of a model for the rest of the country. Manitoba still has a long ways to go. So, I think they eventually will catch up, and I'd like to see all green across the whole country. So I think that would be ideal.
Great. Another question from someone online is first, they start excellent presentation. How do we get this information to family members and friends who may not be aware of the availability of the services pharmacists can do?
Mhm. So I think that's a really good question because I think what I find is sometimes the public is not aware. So I think doing sessions like this, I speak a lot in community. I speak at group homes. I speak at sessions wherever I get the opportunity to speak. I think it's word of mouth as well. And I don't know how more effectively we can get the word out, but I think it's doing things like this sort of at the grassroots level and then exposing patients because I have a base of so many patients now. One patient tells their neighbor and their neighbor tells their neighbor and so on and so forth. I think that's how this needs to spread because we can put ads out, we can put things in the newspaper and but I mean people read and then forget, but it's what you experience at the pharmacy level. And like I said, if you're not getting that service, perhaps not all pharmacists are practicing to the full scope. And so maybe, it's time to switch to a pharmacy that perhaps will provide you with that service.
That's right.
If you don't like the service you're getting from your family doctor, then, by all means, you have the ability to switch. and go somewhere where you get this service. So, I practice to the fullest of my ability and my profession, and I enjoy what I do, and it's making a huge impact. So, like I said, if this is not something you're getting currently today, then you need to ask questions, and we can only put so much advertising, and I can only spread the word as much as I can, but if there's opportunities to speak in other events and avenues, I'm happy to do that and promote this grassroots, information dissemination.
Great. And for those online, we will be sending out an email with a copy of the presentation or link to it. So please do share that on with, your family members and friends, as well as another means of getting that information out. Another question here is from someone asking if they're less than 65, can you get a comprehensive annual care plan? And the subsequent question to that, is it free?
Yes, a comprehensive annual care plan is free. It's paid for by the government. You don't have to be 65 and over. As long as you are on multiple medications and you have chronic conditions, that's one of the criteria where we get paid for that service. Um, and it used to be that we used to get paid to do regular follow-ups, but with the government cutbacks and all of that, but we are able to do one annual care plan per year. But it doesn't mean that, I just do one and then the next one is like, okay, we can't do that. That's not, but we only get paid for one. But, I certainly in my practice, if a patient comes in twice or three times or four times a year, it is upon us to provide that care, even though I get paid for one. It's not about the payment and that it's about taking care of the patient. But one care plan is paid for 1 year, a year, and then there's four follow-ups that we can bill for, which was a change from the past where we could do 12 follow-ups, so one follow-up a month. But we know that most pharmacies, most pharmacists follow up with the patients on a monthly basis. We just don't get paid for it.
Yeah.
And we're advocating to reinstate that because it does take time, and it is something that we feel strongly that the government should pay for. But it doesn't mean that we'll turn you away because you've met your maximum. But it is something that is provided to anyone, no matter what age you are. You don't have to be 65 and over. We have patients who are under the age of 65 who have chronic conditions like blood pressure and cholesterol and heart disease and diabetes. And so it's open to all those clients. And even, obesity management, I practice in the area of obesity management. So I like, when we can make impact on patients' weight and health, and it reduces the risk of diabetes, heart attacks, high blood pressure, right? So preventing you from getting on all those medications, which cost a lot more money.
Yeah. Looking at our time, we have maybe time for one more question. So I'm looking at this one here, and I think this is a good one too. This question comes from a caregiver whose husband has lives with Parkinson's. They go to a Shoppers Drug Mart. They're asking, how do you create a relationship when there are multiple pharmacists on staff at a location?
Yeah, so that is difficult. So I'll be very honest. I'll put it out there. I used to work in a Shoppers and I owned a Shoppers. And again, the reason I left was because I wasn't able to provide that service to the patients in that environment. And you'll find that, the medicine shop or a smaller pharmacy, where, you have that relationship with that consistent person, where where you're not seen as a transaction. You're just not someone who's picking up a prescription, but you're seen as someone who is getting care. I don't see it as a patient when they come into my pharmacy are not just picking up a prescription, they're getting care, and they're getting consistent care. So, the questions I ask, as annoying as it may be with some patients, it's like, do you have any questions? Are you stable on this medication? What is your blood pressure? Can we take a few minutes and just sit down and maybe just monitor your blood pressure? And in some cases, I found patients' blood pressure are skyrocketing, even though they're on blood pressure medication. So that prompts me to follow up with the doctor and say, hey, doc, something's going on with Mrs. Smith because, it doesn't seem right that her blood pressure is sitting at 180 over 110 when she's on blood pressure medication. So again, if you're not getting that from the relationship from a big chain corporate, and you won't get it, I'll be very honest with you, you won't get that same service. And if you are, then I'm grateful that, you have that service. But I find that, you will receive that service from a more smaller, someone who focuses just on pharmacy and not cosmetics and pop and chips and there's too many distractions there. We are a clinic pharmacy. We focus on health. All you get is health and the care and attention you need. And we can spend time with you when you come in. So that's the difference between, some of the pharmacies. And so if you're not getting that today, I think you should be looking at providing and getting that care from somewhere else. Yeah.
Thank you. We'll do one more question and then it out, so this is a good one. What is the best way to administer pills to an individual who has swallowing issues? Is crushing them and putting them in applesauce or pudding a good approach? What if the pills are supposed to be time release?
Yeah, so that's a good question. So not all pills can be crushed or put into applesauce, especially if they're time release. If they're time release, we need to look at changing therapy, first of all, because once you crush that time release tablet, it's no longer time release. It instantaneously goes into your system, and we expect it to work over 12 hours, but now it's not working over 12 hours. So your symptoms are not being managed effectively. So one is, moving to a shorter acting tablet that can be crushed, but maybe taken more frequently. So increasing the dosing interval to make sure that you're still getting the benefit of that medication. And there are options where we work with compounding pharmacies to compound medications that are you're able to swallow or take in. Especially if you're choking or you have a hard time swallowing tablets, we can come up with formulations that are stable and that can help control your symptoms. But the one area is the time release medications. Once you cut it, split it, that's it. That medication doesn't work the way it's supposed to work. Yeah, unfortunately. But we can come up with solutions and options where we can look at other sources of medications that help. But again, I need to know the specific nuances of what
Yeah.
that medication is. Yeah.
So definitely the number one recommendation is, try to follow the medication as best as possible, but always talk to your pharmacist about, if it's not working right or you need suggestions or supports around, administering that medication. So,
Yeah, absolutely.
right. Well, I want to definitely, say thank you again, I mean, for taking your time to come and present today. We didn't get a chance to go through all the questions, so I may follow up with an email with some of these questions that we can send out to individuals and responses in our follow-up email. So thank you, everyone, for all your questions today. I truly appreciate you taking the time to do that. As we close out today's session, I want to again say thank you, Amin, for joining us. A very special thank you to you and taking the time to do that. I do want to highlight a few things from Caregivers Alberta before we close up. One of the things we offer constantly is our resource roadmap. This is a tool designed to help caregivers navigate those supports, programs, community resources available. It breaks down where to start, who to contact, how to access services based on your unique caregiving situation. Genevieve will be sharing through the lovely chat, if it's not there already, a link to that resource so that you can access it. Our next webinar for this year is set and scheduled for Tuesday, September the 22nd, and it will be on the topic of unity and care, exploring cultural differences. During this webinar, we'll explore a powerful conversation on how culture, values, and lived experience shape caregiving and common things that actually bring that caregiving journey together. Lastly, a reminder that a link to the recording will be emailed to you in the coming days. As well, the session can be viewed online on our YouTube channel. Again, on behalf of Caregivers Alberta, thank you everyone for spending your last this hour with us going through this lovely topic. And again, thank you, Amin, for presenting for us today. I wish you all a wonderful rest of your day, and thank you again for attending. Thank you, everyone. Have a great day.
Thank you. Okay, bye.